Describe the four phases of pharmacokinetics: absorption, distribution, metabolism, and excretion, and explain how each phase influences the clinical effectiveness of a drug in a veterinary patient. Provide an example of a drug that exhibits significant variability in one of these phases based on species differences. Answer: pharmacokinetics refers to the study of how a drug is absorbed, distributed, metabolized, and excreted in the body. Each phase plays a critical role in determining the drug's therapeutic outcome. Absorption: this is the process by which a drug enters the bloodstream from its site of administration. Factors influencing absorption include the route of administration, oral, intravenous, etc., the drug's solubility, and gastrointestinal pH. For example, oral drugs may have variable absorption in different species due to differences in stomach pH, enzyme activity, or gut motility. Distribution: once absorbed, the drug is distributed throughout the body via the bloodstream. This depends on factors such as blood flow, plasma protein binding, and the permeability of cell membranes. For instance, lipophilic drugs tend to accumulate in fat tissues more readily in animals with higher fat content like cats. Metabolism: this is the biochemical modification of drugs primarily in the liver. Metabolism can result in either active metabolites which prolong the drug's effect or inactive metabolites. The rate of metabolism can vary significantly between species, such as in cats, which have a limited ability to metabolize certain drugs like acetaminophen due to lower levels of glucuronyltransferase. Excretion: drugs are primarily excreted via the kidneys, but also through the liver, bile, lungs, or sweat. The efficiency of renal excretion varies between species. For instance, dogs may excrete drugs more rapidly than cats, which are known to have slow renal clearance. What are the advantages and disadvantages of intravenous Roman versus subcutaneous SC drug administration in veterinary practice? Discuss how the drug's pharmacokinetic properties influence the choice of route. Answer: intravenous Roman administration. Advantages: rapid onset. The drug is delivered directly into the bloodstream, ensuring immediate therapeutic effects. Complete bioavailability. No absorption phase, so the full dose reaches the systemic circulation. Precise control. The exact dose can be delivered, and effects can be closely monitored. Disadvantages: require skill. IV injections or infusions require technical expertise to avoid complications such as infiltration, thrombophlebitis, or infection. Short duration of action. The drug is rapidly distributed and eliminated, which may necessitate continuous infusion or frequent administration. Subcutaneous SC administration. Advantages: easier to administer. SC injections are simpler and can often be done by technicians or owners at home. Sustained release. Drugs administered SC are absorbed more slowly, providing a longer duration of action. Disadvantages: slower onset. It takes longer for the drug to be absorbed into the bloodstream. Incomplete bioavailability. Some drugs may not be as well absorbed SC as via IV due to factors like local tissue perfusion or drug formulation. The choice between IV and SC depends on the drug's characteristics. For example, a drug that requires rapid therapeutic effects, such as an anesthetic, would typically be given IV, while a drug that needs a slow, sustained release like insulin is often administered SC. The clinic you work at has recently received a shipment of controlled substances. Describe the legal protocols and safety procedures for handling and storing controlled substances in a veterinary practice. Answer: controlled substances are drugs that have the potential for abuse and addiction, regulated by the Drug Enforcement Administration, D, in the United States. Veterinary clinics must comply with strict legal protocols for the handling, storing, and administering these substances. Registration: the veterinary clinic must be registered with the DEA to legally store and prescribe controlled substances. Storage: controlled substances must be stored in a locked cabinet or safe with limited access. The storage area should be secured and monitored, often with surveillance, to prevent unauthorized access. Record keeping: the clinic must maintain accurate and detailed records of controlled substances, including the quantity received, the quantity administered or dispensed to clients, the quantity remaining in stock. These records must be kept for a minimum of 2 years and be available for inspection by the DEA at any time. Disposal: expired or unused controlled substances must be disposed of in a manner that complies with DEA regulations, typically by returning them to a licensed reverse distributor or using an approved disposal method. Reporting: any theft, loss, or significant discrepancies must be reported immediately to the DEA. Mr. Reynolds, a dog owner, accidentally administered 10 times the recommended dose of a medication to his dog. The dog has shown signs of overdose, including vomiting, lethargy, and tremors. What should Mr. Reynolds do, and how should the veterinary technician proceed in this situation? Answer: in this scenario, the first step is for Mr. Reynolds to immediately contact a veterinarian. Overdoses can lead to severe complications and prompt medical intervention is critical. The veterinary technician should assess the dog's condition, take a thorough history, how much and when the overdose occurred, and perform a physical exam. Induce vomiting if appropriate. Depending on the type of drug involved, the veterinarian may decide to induce vomiting to prevent further absorption, ideally within the first 1-2 hours after ingestion. Activated charcoal. If the drug is still in the stomach, activated charcoal may be administered to absorb the drug and reduce further systemic absorption. Monitor vitals and provide symptomatic treatment. The technician should monitor the dog's heart rate, blood pressure, and temperature and administer supportive aeromanoids, oxygen, etc. as required. Consult poison control. If the drug involved is a known toxic substance, the technician should consult a veterinary poison control center for specific guidance. Explain how non-steroidal anti-inflammatory drugs, NSAIDs, work to alleviate pain and inflammation. Discuss the risks associated with prolonged NSAID use in veterinary patients. Answer: NSAIDs work by inhibiting the enzyme cyclooxygenase COX, which is responsible for converting arachidonic acid to prostaglandins. Prostaglandins are mediators of inflammation, pain, and fever, so by blocking COX, NSAIDs reduce these symptoms. COX-1 is involved in the production of prostaglandins that protect the stomach lining, support kidney function, and regulate platelet aggregation. COX-2 is primarily involved in inflammation and pain. Most veterinary NSAIDs target COX-2 to provide anti-inflammatory effects while minimizing gastrointestinal side effects. However, long-term use of NSAIDs can lead to gastrointestinal ulcers due to the inhibition of COX-1, which affects mucosal protection in the stomach. Renal toxicity. NSAIDs can reduce renal blood flow, leading to kidney damage, especially in dehydrated or compromised animals. Hepatic toxicity. Some NSAIDs can cause liver damage, and close monitoring of liver function is necessary during prolonged use. Describe strategies that veterinary practices can implement to prevent medication errors when prescribing or administering drugs. Answer: medication errors in veterinary practice can be minimized through several strategies. Clear communication. Ensure that all drug prescriptions and instructions are clear, legible, and include critical information. E.g., dosage, route frequency. Double-checking dosages. Always verify the drug and dosage before administration, particularly in high-risk situations. E.g., injectable drugs, high-potency medications. Use of computerized systems, electronic health records, and medication management systems can help reduce errors by alerting staff to potential drug interactions, allergies, or dosage errors. Staff training. Regular training on drug safety, adverse reactions, and the correct techniques for administering various drugs, oral, injectable, topical. Patient identification. Ensure the correct animal is receiving the correct medication by using identification systems such as color-coded bands or electronic tags. Explain the potential effects of drug-drug interactions in veterinary medicine, particularly with regard to how one drug can alter the pharmacokinetics or pharmacodynamics of another. Answer: drug-drug interactions can occur when 2 or more drugs are administered together, leading to altered therapeutic outcomes. These interactions can affect pharmacokinetics, how the body processes the drug, or pharmacodynamics, how the drug affects the body. There are several types of drug interactions. Pharmacokinetic interactions. One drug may alter the absorption, distribution, metabolism, or excretion of another drug. For example, some drugs may inhibit liver enzymes like cytochrome P, altering the metabolism of other drugs, leading to increased levels and potential toxicity. Pharmacodynamic interactions. One drug may enhance or inhibit the effect of another at the receptor level. For example, combining 2 CNS depressants like benzodiazepines and opioids can cause excessive sedation and respiratory depression. Explain how different routes of drug administration can affect the absorption rate of a medication in veterinary patients. Answer: the route of administration plays a crucial role in the absorption rate and bioavailability of a drug. The main routes of administration include oral PO. Drugs given orally must pass through the gastrointestinal tract where they are absorbed into the bloodstream. Absorption can be slower and less predictable due to factors like gastric pH, presence of food, and the digestive process. Intravenous Roman drugs administered IV enter the bloodstream directly, resulting in immediate absorption and a 100% bioavailability. This is ideal for emergencies or drugs that require rapid action. Intramuscular drugs given IM are absorbed more slowly than IV but faster than oral medications. Subcutaneous SC. Like IM, subcutaneous injections are absorbed slowly into the bloodstream through the subcutaneous tissue, but absorption rates can vary based on factors like tissue perfusion. Topical medications are applied directly to the skin or mucous membranes and are absorbed locally or, in some cases, systemically. Describe how the binding of a drug to a receptor can influence the pharmacological response in a veterinary patient. Answer: when a drug binds to a receptor, it can trigger a series of biochemical events that result in a pharmacological response. This interaction can lead to different types of effects. The agonist: a drug that binds to a receptor and stimulates a response. Agonists can have varying degrees of activity from partial to full stimulation. For example, morphine is an opioid agonist that binds to opioid receptors and provides pain relief. Antagonist: a drug that binds to a receptor but does not activate it, blocking the receptor's activity. Antagonists can prevent endogenous substances, e.g., neurotransmitters, hormones, or other drugs from binding to the receptor. An example is naloxone, which is an opioid antagonist used to reverse opioid toxicity. Partial agonist: this drug binds to a receptor but produces a weaker response compared to a full agonist. It may also act as an antagonist in the presence of a full agonist, as it can displace the full agonist from the receptor without inducing the same level of effect. What is antimicrobial resistance (AMR), and what strategies can veterinary professionals use to reduce the risk of developing AMI in animal patients? Answer: antimicrobial resistance (AMR) occurs when microorganisms, such as bacteria, fungi, and parasites, develop the ability to resist the effects of drugs that once killed or inhibited them. This can result from overuse or misuse of antibiotics and other antimicrobial drugs. In veterinary medicine, AMR can complicate treatment and prolong infections in animals, and then can also pose a risk to human health when resistant organisms spread. Strategies to reduce AMR: judicious use of antibiotics. Avoid overprescribing antibiotics, especially broad-spectrum ones, and ensure they are used only when necessary. Correct dosage and duration. Administer the correct dose for the appropriate duration to ensure the infection is fully treated, preventing the development of resistant strains. Culture and sensitivity testing. Perform these tests to determine the most effective antimicrobial agent for a specific infection, reducing unnecessary use of antibiotics. Preventive care. Promote vaccination, hygiene practices, and proper nutrition to prevent infections that require antimicrobial treatment. Client education. Educate pet owners about the importance of following prescribed treatment regimens and not sharing medications with other animals or humans. Mr. Thompson brings his dog Max to the clinic after noticing signs of lethargy, vomiting, and diarrhea. After some tests, Max is diagnosed with parvovirus. Given that parvovirus is highly contagious, what precautions should the veterinary clinic take in order to prevent the spread of this infectious disease to other animals? Answer: parvovirus is a highly contagious viral disease that affects dogs, particularly puppies. It is transmitted through fecal-oral routes, and even a small amount of contaminated feces can spread the virus. In Mr. Thompson's case, the clinic should take the following precautions. Isolation. Max should be isolated immediately in a designated area for infectious patients to prevent cross-contamination with other animals. Personal protective equipment (PPE). Staff members handling Max should wear gloves, masks, and gowns to avoid spreading the virus. Disinfection. All surfaces, equipment, and areas that have come into contact with Max should be thoroughly disinfected with a disinfectant effective against parvovirus, such as one containing chlorine bleach, limiting exposure. No other animals should be allowed in the treatment area where Max is being kept. All animals should be kept in separate, well-ventilated areas. Proper handling of waste. Any waste material, such as feces, should be disposed of safely and cleaned with an appropriate disinfectant. By following these protocols, the clinic can help minimize the risk of an outbreak among other patients. What are the key differences between bacterial and viral infections in animals, and how do they impact treatment protocols? Answer: bacterial and viral infections differ significantly in terms of their nature, transmission, and treatment. Bacterial infections: nature, caused by single-celled organisms, bacteria that can multiply rapidly inside the host. Transmission: bacteria can spread through direct contact, contaminated water, food, or vectors. Treatment: bacterial infections are typically treated with antibiotics that specifically target the bacteria responsible for the infection. The choice of antibiotic depends on the type of bacteria and its susceptibility via culture and sensitivity testing. Examples: leptospirosis, staphylococcus infections, viral infections, nature, caused by viruses, which are much smaller than bacteria and require a host cell to replicate. Viruses often cause systemic infections. Transmission. Viruses can spread through direct contact, respiratory droplets, or contaminated environments. Treatment. Viral infections cannot be treated with antibiotics as they target living cells. Antiviral medications may be used in some cases, but often treatment is supportive, fluid therapy, pain relief, etc. Examples: canine parvovirus, feline calicivirus. The key difference lies in the approach to treatment. Antibiotics are effective against bacterial infections but not viral ones. Therefore, correct diagnosis and distinguishing between these infections is critical for selecting the appropriate treatment. How does zoonotic transmission of diseases impact veterinary practice, and what are the best practices for minimizing the risk of zoonotic diseases in a clinic? Answer: zoonotic diseases are those that can be transmitted from animals to humans. These diseases can have significant implications for veterinary practice, as veterinarians, technicians, and pet owners are all at risk. Examples include Lyme disease, rabies, and ringworm. Minimizing the risk of zoonotic diseases in veterinary clinics requires proper hygiene and PPE. Veterinary staff should always wear gloves, masks, and other protective equipment when handling potentially infected animals or animal waste. Vaccination. Ensuring that pets are up to date on vaccinations, particularly for diseases such as rabies, which are highly zoonotic. Disinfection and sanitation. All equipment and surfaces should be regularly disinfected with appropriate cleaning agents that are effective against zoonotic pathogens. Education. Staff should be educated on the risks of zoonotic diseases, how to recognize symptoms, and how to prevent transmission. Client education. Pet owners should be informed about the risks of zoonotic diseases, particularly those transmitted through direct contact with their pets or through the environment. Dr. Turner is treating a 5-year-old dog, Bella, who presents with excessive drinking, urination, and weight loss. After a blood test, the results suggest hypoglycemia and the possibility of diabetes mellitus. What diagnostic steps should Dr. Turner take to confirm this diagnosis, and what treatment options should be considered? Answer: in this case, Dr. Turner has already observed key clinical signs of diabetes mellitus, excessive drinking, urination, and weight loss, and identified hypoglycemia through a blood test. To confirm the diagnosis, the following steps should be taken. Confirming hypoglycemia. A repeat blood glucose test should be performed to verify the high glucose levels, as stress can sometimes cause transient hypoglycemia. Urinalysis. Urine testing should be conducted to check for glucosuria, glucose in the urine, which is a common sign of uncontrolled diabetes. Fructosamine test. This test measures the average blood glucose concentration over the past 1-2 weeks and is useful in confirming a diagnosis of diabetes. Assessment for complications. Dr. Turner should assess for potential complications of diabetes, such as diabetic ketoacidosis, through a blood gas analysis or infections, urinary tract infections. Once diabetes is confirmed, treatment options typically include insulin therapy. Most dogs with diabetes mellitus require insulin injections to regulate blood glucose levels. Dietary management. A special diet designed to help control blood sugar levels is often recommended, including a high-fiber, low-fat diet. Monitoring. Regular follow-up visits for blood glucose monitoring and insulin dose adjustments are necessary to ensure proper disease management. What are the clinical signs and diagnostic methods used to identify respiratory conditions such as pneumonia and asthma in small animals? Answer: respiratory conditions like pneumonia and asthma are common in small animals and can often present with similar clinical signs, but their underlying causes and treatments differ significantly. Pneumonia. Clinical signs: coughing, labored breathing, nasal discharge, fever, lethargy, and sometimes anorexia. Diagnostic methods. Diagnosis typically involves physical examination. Auscultation may reveal crackles, wheezes, or decreased lung sounds. Radiographs, X-rays. X-rays can show consolidation of the lung tissue, indicating pneumonia, or signs of fluid accumulation. Blood tests. Elevated white blood cell count is common in bacterial pneumonia. Tracheal wash or bronchoscopy. Sampling the respiratory tract to identify the causative organism can help tailor treatment. Asthma. Clinical signs: wheezing, coughing, increased respiratory effort, and signs of airway constriction, especially after exposure to allergens. Diagnostic methods: physical examination. Wheezing or prolonged expiration may be detected. Radiograph. X-rays may show lung hyperinflation and bronchial patterns. Bronchial cytology. A tracheal wash or bronchoscopy may reveal eosinophilic inflammation, which is typical in asthma cases. The key difference in treatment lies in the use of bronchodilators and corticosteroids for asthma, while antibiotics and supportive care are used for pneumonia. Mrs. Anderson brings her cat Felix to the clinic after noticing that he is lethargic, has a loss of appetite, and is scratching excessively. Upon examination, Dr. Lee suspects an autoimmune disorder, possibly systemic lupus erythematosus, SLE. What diagnostic tests should be performed to confirm SLE, and what treatment options are available for autoimmune diseases in cats? Answer: systemic lupus erythematosus, SLE, is a rare but serious autoimmune disorder in cats that can cause widespread inflammation and organ damage. To confirm SLE, Dr. Lee should perform complete blood count CBC. A CBC can identify anemia, thrombocytopenia, or leukopenia, which are often seen in autoimmune diseases. Serological tests, antinuclear antibody testing, is commonly used to diagnose SLE. In cats, a positive ANA test along with clinical signs can suggest SLE. Urinalysis to assess for renal involvement, as lupus can affect the kidneys. Immunohistochemistry or biopsy. In some cases, biopsy of affected tissues may be required to confirm the diagnosis. Treatment for autoimmune diseases such as SLE typically involves immunosuppressive drugs like corticosteroids, prednisone, or cytotoxic agents as aethioprine. Long-term management involves close monitoring to adjust medication dosages and minimize side effects. What are the common causes and treatment strategies for gastrointestinal issues such as vomiting, diarrhea, and pancreatitis in dogs? Answer: vomiting and diarrhea. Causes: these can be caused by dietary indiscretion, infections, bacterial, viral, or parasitic, toxins, or systemic diseases like liver disease. Treatment strategies: treatment often involves supportive care, fluid therapy to prevent dehydration, especially if vomiting or diarrhea is severe. Dietary management: a bland diet may be recommended for 8 hours, followed by gradual reintroduction of regular food. Anti-nausea medications. Medications like meropenem, Cerenia can be used to control vomiting. Antibiotics or anthelmintics. If a bacterial or parasitic infection is suspected, appropriate medications will be used. Pancreatitis. Causes: pancreatitis can result from a high-fat diet, obesity, or trauma. Treatment includes IV fluids to manage dehydration and maintain electrolyte balance. Pain management. Pain relief. Opioids is important for controlling abdominal discomfort. Dietary restriction. Feeding the dog a low-fat, easily digestible diet once it has stabilized. Monitoring. Regular monitoring of pancreatic enzymes e.g. amylase, lipase, and abdominal ultrasounds may be necessary. What are the diagnostic criteria and treatment options for common autoimmune diseases in small animals, such as lupus and immune-mediated hemolytic anemia (IMHA)? Answer: lupus. Diagnosis. The diagnosis is often based on clinical signs e.g. joint pain, skin lesions, fever, and laboratory tests such as ANA titers and biopsy of affected tissues. Treatment. The treatment involves immunosuppressive drugs, prednisone, and sometimes cytotoxic agents e.g. cyclophosphamide. Immune-mediated hemolytic anemia (IMHA). Diagnosis. IMHA is diagnosed through blood tests showing a regenerative anemia, positive Coombs test, and the presence of autoantibodies. Treatment. Treatment involves immunosuppressive drugs, prednisone, and sometimes blood transfusions for severe anemia. What are the primary factors influencing the development and progression of osteoarthritis in small animals, and what are the best treatment strategies to manage this condition? Answer: osteoarthritis OA is a degenerative joint disease that can affect various species, including dogs and cats. The primary factors that contribute to the development and progression of osteoarthritis in small animals include age. Older animals are more prone to osteoarthritis due to wear and tear on joints over time. Breed and genetics. Certain breeds, particularly large and giant breeds e.g. Labrador Retrievers, German Shepherds, are predisposed to developing OA due to genetic factors. Joint dysplasia. Conditions such as hip dysplasia or elbow dysplasia can increase the risk of OA due to abnormal joint structure and function. Obesity. Excess body weight puts additional stress on joints, accelerating the development of arthritis. Injury or trauma. Previous joint injuries or ligament ruptures can predispose animals to developing OA due to the altered mechanics of the affected joint. Treatment strategies for managing osteoarthritis in small animals typically include pain management. Non-steroidal anti-inflammatory drugs, NSAIDs, such as carprofen or meloxicam, are commonly used to reduce inflammation and pain. In severe cases, corticosteroids may be used for short-term relief. Joint supplements. Glucosamine and chondroitin sulfate are often recommended to support joint health and improve cartilage function. Physical therapy. Rehabilitation techniques such as hydrotherapy and controlled exercise can help strengthen muscles around the affected joints, reducing strain and improving mobility. Weight management. Maintaining a healthy weight through a balanced diet is essential to reduce the load on joints and slow the progression of OA. Surgical intervention. In cases where medical management is insufficient, surgical options such as joint arthroscopy or joint replacement may be considered. 3-year-old cat Oscar presents with difficulty breathing, wheezing, and a history of coughing. Dr. Patel suspects asthma but wants to rule out other potential causes. What diagnostic steps should Dr. Patel take to confirm feline asthma, and what are the typical treatment options for managing this condition? Answer: feline asthma is a common respiratory condition characterized by inflammation and constriction of the airways, leading to difficulty breathing, coughing, and wheezing. To confirm feline asthma and rule out other potential causes of respiratory distress, Dr. Patel should: physical examination. A thorough examination may reveal wheezing or labored breathing, which is characteristic of asthma. Chest radiographs, X-rays. X-rays can help identify bronchial patterns or lung hyperinflation, which are typical signs of asthma in cats. Bronchoalveolar lavage, BAL, or cytology. A sample of airway fluid can be collected through bronchoalveolar lavage to check for inflammatory cells, such as eosinophils, which are commonly seen in asthma. Blood tests. Elevated eosinophil count in the blood may support a diagnosis of asthma, though it is not definitive. Rule out other conditions. Dr. Patel should rule out other causes of respiratory signs, such as heartworm disease infections or foreign body aspiration, through appropriate tests, e.g. heartworm test, bacterial cultures. Treatment options for feline asthma typically involve bronchodilators. Medications like albuterol or terbutaline can help open up the airways and relieve wheezing. Corticosteroids, prednisone or inhaled steroids, e.g. fluticasone, can help reduce inflammation in the airways and manage chronic symptoms. Environmental management. Reducing exposure to potential allergens, e.g. dust, smoke, or strong odors, is important for preventing flare-ups. Oxygen therapy. In severe cases of asthma, oxygen therapy may be necessary to support breathing. By managing asthma effectively, most cats can lead a comfortable and active life. What is the difference between the terms proximal and distal when referring to the anatomy of a limb, and how does this terminology help in clinical assessments? Answer: the terms proximal and distal are relative directional terms used to describe the position of structures along a limb or the body in relation to a reference point, usually the trunk or the point of attachment. Proximal refers to a structure that is closer to the point of attachment or origin, typically the body trunk. Distal refers to a structure that is farther from the point of attachment or origin. For example, in the front limb of an animal, the shoulder joint is proximal to the elbow while the paw is distal to the elbow. This terminology is essential in clinical assessments, such as when describing lesions or injuries. A veterinarian may specify that a wound is distal to the elbow or proximal to the wrist to precisely locate the injury in relation to the limb. Relevant concepts: anatomical positioning, essential for effective communication among veterinary professionals. Clinical application, helps in performing physical exams and understanding pathology, for example, knowing which joint or bone is affected. Clinical examination of the respiratory system. What key features would a veterinarian assess to ensure proper lung function in an animal? Answer: during a clinical examination of the respiratory system, the veterinarian would assess several key features: respiratory rate and rhythm, the number of breaths per minute and whether they are regular or irregular. Tachypnea increased rate or bradypnea decreased rate could indicate pathology. Respiratory sounds. The presence of abnormal sounds, such as wheezing, crackles, or stridor, can suggest obstructions, infections, or fluid buildup in the lungs. Mucous membrane color, cyanosis, blue discoloration can be an indication of hypoxia, insufficient oxygen in the blood. Pulse oximetry. This non-invasive method measures the oxygen saturation of hemoglobin in the blood. Normal levels are typically between 95–100%. Values below this may indicate respiratory compromise. Additionally, auscultation, listening to lung sounds with a stethoscope and percussion, tapping the chest to assess resonance, would be performed to identify signs of consolidation or air trapping in the lungs. Mr. Thompson, a pet owner, brings in his 5-year-old dog Max, complaining that Max has been lethargic and has been drinking more water than usual. Upon examination, the veterinarian notices that Max's breath has a fruity odor and his heart rate is elevated. Based on these symptoms, what condition might the veterinarian suspect, and what are the next steps in diagnosis? Answer: the veterinarian should suspect diabetes mellitus given Max's increased thirst, polydipsia, lethargy, and fruity breath odor, which is commonly associated with ketoacidosis in diabetic animals. Elevated heart rate tachycardia is another common sign of metabolic disturbances like ketoacidosis. The next steps in diagnosis would include blood glucose test. A high blood glucose level would confirm diabetes mellitus. Urinalysis. Testing for glucose and ketones in the urine can further support the diagnosis. Serum chemistry panel. This test will help assess kidney function, liver enzymes, and electrolytes, which can be affected by diabetes and ketoacidosis. Complete blood count CBC. This may show signs of infection or dehydration. Relevant laws and guidelines. Veterinary medical guidelines. Always take a thorough history and perform a detailed clinical examination before forming a diagnosis. Ethics of veterinary care. Diagnosing and treating diabetic animals requires knowledge of insulin therapy and patient management to ensure the best quality of life. Describe how the structure of the kidney supports its function in regulating fluid and electrolyte balance. Answer: the kidneys are highly specialized organs that play a critical role in regulating fluid and electrolyte balance through the following structures. Nephrons. Each kidney contains millions of nephrons, which are the functional units responsible for filtration. The nephron includes the glomerulus, proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting duct. Glomerulus. Blood is filtered in the glomerulus with water, electrolytes, and waste products being removed from the bloodstream. Tubular reabsorption and secretion. As the filtrate moves through the tubules, vital substances like sodium, potassium, and water are selectively reabsorbed back into the bloodstream, while waste products and excess electrolytes are secreted into the urine. Countercurrent exchange mechanism, loop of Henle. The loop of Henle allows for the reabsorption of water and sodium, concentrating urine and conserving water when the body is dehydrated. These processes ensure that the body maintains homeostasis by regulating blood volume, electrolyte levels, and pH balance. What is the role of the pancreas in regulating blood glucose levels, and how does dysfunction in this organ contribute to diseases like diabetes mellitus? Answer: the pancreas plays a crucial role in regulating blood glucose levels through its endocrine function, specifically through the secretion of insulin and glucagon. Insulin, secreted by beta cells in the pancreas. Insulin facilitates the uptake of glucose into cells for energy production or storage. This lowers blood glucose levels. Glucagon, secreted by alpha cells. Glucagon stimulates the release of glucose from the liver stores glycogen into the bloodstream, thus raising blood glucose levels. In diabetes mellitus, the pancreas either does not produce sufficient insulin, type 1 diabetes, or the body becomes resistant to insulin, type 2 diabetes. As a result, blood glucose levels remain elevated, leading to the classic symptoms of diabetes such as increased thirst, urination, and hunger. Relevant concepts. Endocrine system. The pancreas is a key endocrine organ involved in metabolic regulation. Pathophysiology. Dysfunction in insulin secretion or insulin action leads to the clinical signs and symptoms of diabetes mellitus. In the musculoskeletal system, what is the significance of synovial fluid, and how does its composition support joint function? Answer: synovial fluid is a viscous liquid found within synovial joints that plays a critical role in joint function by lubricating the joint, reducing friction between the articular cartilages of the bones, which helps prevent wear and tear on the cartilage. Nutrient supply. The fluid provides nutrients to the avascular articular cartilage, which does not have a direct blood supply. Shock absorption. Synovial fluid helps to distribute forces across the joint, minimizing stress on the bones and cartilage during movement. The fluid is produced by the synovial membrane, and its composition includes hyaluronic acid for viscosity and lubricin for additional lubrication. Changes in the composition of synovial fluid, such as in arthritis, can lead to joint pain and dysfunction. Relevant concepts. Joint health. Proper function of synovial fluid is crucial for the smooth movement of joints. Clinical relevance. Disorders like rheumatoid arthritis can lead to changes in the volume and composition of synovial fluid, contributing to inflammation and pain. Explain how the nervous system coordinates the body's response to external stimuli. Answer: the nervous system coordinates the body's response to external stimuli through its ability to detect, process, and respond to changes in the environment. This process occurs in several stages: detection, sensory input, sensory receptors in the body, G. Skin, eyes, ears detect stimuli such as light, temperature, or pressure. Transmission, signal propagation. The sensory neurons transmit electrical signals, action potentials to the spinal cord and brain. Integration, processing. The central nervous system (CNS) processes these signals, integrating them with information from past experiences, and formulates an appropriate response. Response, motor output. The CNS sends signals via motor neurons to effectors, muscles, or glands to produce a response, such as muscle contraction or gland secretion. This feedback loop allows the body to respond rapidly to environmental changes, maintaining homeostasis and ensuring survival. What is the role of erythrocytes in the circulatory system, and how does their structure facilitate their function? Answer: erythrocytes, or red blood cells, are responsible for transporting oxygen from the lungs to the tissues and carbon dioxide from the tissues to the lungs. Their structure is highly specialized to support this function. Biconcave shape. This increases the surface area for gas exchange and allows the cells to deform as they pass through small capillaries. Hemoglobin content. Hemoglobin, a protein in erythrocytes, binds to oxygen and carbon dioxide, facilitating efficient transport of gases. Lack of nucleus. Erythrocytes lack a nucleus, providing more space for hemoglobin and allowing for maximum oxygen carrying capacity. These features enable erythrocytes to effectively carry out their role in oxygen delivery and carbon dioxide removal. Relevant concepts: oxygen transport. Hemoglobin's affinity for oxygen is influenced by factors such as pH and temperature. Anemia. Conditions like anemia, which result from a deficiency in red blood cells or hemoglobin, can impair the body's ability to deliver oxygen effectively. How does the structure of the heart contribute to its ability to pump blood throughout the body? Answer: the heart's structure is specialized for its role as a pump. Chambers. The heart consists of 4 chambers: 2 atria upper and 2 ventricles lower. The atria receive blood, while the ventricles pump blood out. Valves. The heart has 4 valves: tricuspid, pulmonary, mitral, and aortic, that prevent backflow and ensure unidirectional blood flow. Muscle layer. The heart's muscular wall, myocardium, is thickest in the ventricles, especially the left ventricle, which pumps blood throughout the body. The right ventricle pumps blood to the lungs. These structural components work together to maintain efficient blood circulation, supporting both systemic and pulmonary circulations. Relevant concepts: cardiac cycle describes the sequence of events during one heartbeat, including contraction, systole, and relaxation. Diastole. Heart disease. Structural abnormalities like valve defects or cardiomyopathy can impair heart function. What is the physiological significance of the blood-brain barrier in maintaining the health of the central nervous system? Answer: the blood-brain barrier (BBB) is a selective permeability barrier that protects the brain from harmful substances in the blood while allowing essential nutrients to pass through. Endothelial cells. These cells form tight junctions that restrict the movement of large molecules and pathogens into the brain. Transport mechanisms. Specialized transporters facilitate the passage of glucose and amino acids, which are crucial for brain function. Immunological protection. The BBB prevents immune cells in the bloodstream from easily entering the brain, thus reducing the risk of inflammation or infection in the central nervous system. The BBB is crucial for protecting the brain from toxins, pathogens, and fluctuations in ion concentrations, ensuring a stable environment for neuronal activity. Relevant concepts: neurovascular unit involves endothelial cells, astrocytes, and pericytes working together to maintain BBB function. Clinical relevance: conditions such as meningitis or encephalitis can compromise the integrity of the BBB, leading to potential brain damage.